osteoarthritis or lumbar spondylosis, cervical spondylosis, etc. Sandhigata Vada Chikitsa is prescribed here. Kashayas, whatever we have told earlier, if there is Anubandha dosha, we have to go for Amadosha, Amavajana Chikitsa, Dushana Lengana Chikitsa, Shopagana Chikitsa. Jura is not usually seen. Dasna Panjaga, Saptavam, Gulgulu Diktan, Dasna Radadi, followed with Brahmana Chikitsa, Vidaryadi, Maharashnadi, etc. Gulgulu yogas can be Prasheba, Churna can be Prasheba, Hridan can be used. Dasnadi Hrida. Dasnadi Hrida is having very good Brahmana property. Dronaivam Sadhe Dasna, Deshamura Sadavari, which is mentioned in Kasa Chikitsa. Panjagasam, Shira Kamba. Musculoskeletal or neurological diseases are also mentioned. Then Abhyangam, Ubanaga Sweda, Churnapinda Sweda, Patra Bodala Sweda, Vasti, etc. Fast joint exercise and physiotherapy is also very good. Then coming to spondylolisthesis. What we are seeing this patient, spondylolisthesis coupled with the spondylolysis. The classification of spondylolisthesis, you can refer these slides. That is grade 1, 25 up to 25% slippage is there, grade 1. Grade 2, there is up to 25, between 25 and 50%. Grade 3, 50 to 75%. Grade 4 is not usually, it is surely grade 3 and 4 are surgical. Many people are having no symptoms. Unless you are taking an X-ray, you cannot diagnose it. People may be asymptomatic. Low back pain is the common symptom. Pain some days spread across lower back and hip, and some days travel to the hamstring muscles, posterior thigh. Muscle spasms may occur. Tight hamstrings can be felt. Sometimes this can be associated with lumbar spondylosis, which may be causing sciatic pain, tingling or numbness on the foot. Here you can use braces or lumbar corsets, etc., to avoid further displacement of the vertebra. Braces for spondylolysis. These are the types of spondylolysis: ischemic, degenerative, traumatic, pathologic, then display, that is congenital. This is an X-ray showing the grade, that is second degree, or that is between 25 to 50 degree displacement of percentage displacement of L5 over S1. This is another one showing more than 50% displacement. This one is spondylolysis, that is usually associated with the spondylolisthesis. There is a gap in the pars interarticularis region, in the posterior, near to laminae. What we are doing with the spondylolisthesis, explain the prognosis. That means if the grades are or higher grades are there, we can make it experimentally. We can do with the after convincing the patient or explaining the prognosis. We can. But initially, few days Rushana with the Dibara Bhajana. Especially the obesity is very obese patients are very difficult to treat, because obesity, if you are reducing 5 kg body weight, that alone can be making some 25% improvement in this symptoms, or that much relief can be. That is, getting lean is very important. Then Snehapana, that is, there is Astyasrita or Majjasrita. Snehapana, after determining the age and other Sattva Sadmin Tadaharam Avastha, we can decide the dosage of the Sneha. Usually given Gulgulu Dikta. Samvahana excluding listhesis part, we don't have to give much pressure on that. Usually Portala Svedas we are not doing Portala Svedas for listhesis. If the listhesis is active, Svedam can be done. Nadi Svedam or other Svedas can be. Murdu Shodhanam. Dhanyamla Dhara or Kashaya Dhara. Upanaha Sweda is very excellent because it can improve the paraspinal muscle strength. That is very important. We cannot exactly place the vertebra in correct position. Only the major thing is the improvement in the muscle strength, para muscle strength, that can give symptomatic relief to the patient. Then Yavaraki, without much application or pressure to the displaced vertebra. Kadivasti is a moderate thing. It is a soft procedure that can be. Tailavasti in Arohana Matra and Kashayavasti, these all are beneficial to the patient. This is a retrol is very difficult to cure because it is encroaching into the spinal canal. L5 is encroaching into the posterior area, that is spinal canal. It is very difficult to cure. Then I don't know whether I have to go for ankylosing spondylitis. It's a very difficult disease. Dr. Priya?
Oh, sir.
Shall I go for ankylosing spondylitis?
Okay, sir. You can continue.
The causes, because the cases are not common. In India, that can be, in our country, this can be told as a rare case. But in European community, in Caucasian community, it is not rare. Without exact cause is not determined. Genetic factors seem to be involved. In particular, people who have a gene called HLA-B27 are at greatly increased risk of developing AS. That is very important. That is, presence of HLA-B27 gene or antigen is very crucial in developing ankylosing spondylitis. There is a question: can all people with HLA-B27 be subject to ankylosing? Answer is no. Only some people with the gene develop this condition. And coming to our genetic makeup may be different in Asians, even though HLA-B27 positivity is very low in our place when compared with the European or Caucasian population. Risk factors: sex, men are more likely to develop than women. Age, onset usually occurs in late adolescence or early adulthood, because usually what we think the Vadarogas are usually happening in the second half of the life, but here it can happen in adolescence or in early adulthood. Usually the patients what we treat are 15 years or 20 years or below 30 years. Most people have HLA-B27 gene. That is according to theory. But in our country, people are not having that much HLA-B positivity. What are the complications? Severe newborn formation happens in spinal ligaments. That means that ought not to be happened in spinal ligament. Soft tissue should be remained as soft tissue, that ligament. When it is getting calcified, the mobility is grossly affected. For example, the forward bending is affected. Anyway, patient is having some kyphosis there, but forward the bending is affected. That is, a test for the heel, that is finger to ground distance is one test, whether the patient can touch the floor with his finger. And we have to measure how many centimeters. Usually, what the initially freshly diagnosed, we can see 30 centimeters or 1 feet away from the floor. That is very yappy rogas. Then chest expansion is another test. Chest expansion should be more than 5 centimeter in normal subjects, and usually in AS patients we are coming to 2 centimeter, 1 centimeter, 2 centimeter, or 3 centimeter. Then gradually the body, spine and mainly the spine. Usually the disease happens with SI joints and it is usually ascending with L5S1, L4, L5S1. Likewise, it is ascending to the cervical spine, and finally it may affect the neck movements. That is, rotation and the flexion extension of the neck is also affected. But the very beneficial thing is very good news about is Ayurveda treatment is very, very very, very beneficial in improving the symptoms of the disease, or we cannot get rid of the disease. We cannot totally cure the disease, but patient may be, in the initial stages, patient may be becoming asymptomatic, and in chronic cases, they may be having some improvement in their movement, and we are coupling with our treatment, internal medicines. Usually, Gandharvasadi Kashaya is initially used because there is a perpetual tendency to form inflammation in the spine and sacroiliac joints. Usually, Anulomanatha, that is Vaishwadhara Churna, mixed with the Gandharvasadi, and in severe cases, Eranda mixed with the Gandharvasadi, followed with the Gurgulu presence is good for Yasna Sapta Kashaya is good initially. Even Amrudotram can be good when there is CRP and ESR are positive. Gandharvasadi can be clubbed with Amrudotram or Abhaya Pipali Mula. The Abhaya Pipali Mula is a good Kashaya. Abhaya Pipali Mula, Shamyaga Kaduga Hana, Dukvibanda, Illa slash. It is told in Jwara Chikitsa. It is good in reducing the ESR and CRP. So we are clubbing it is connecting it is associated with Gandharvasadi. Together we are morning Gandharvasadi and evening Abhaya Vipali Muladi or Amrudotram. In later stages, shifting to Dasna Sapta. And in severe restrictions, Punardhavadi can be used in afternoon. Parts of spine become stiff and inflexible. Fusion can also stiffen rib cage, restricting lung capacity and function. That means if the untreated case means the patient may die due to dyspnea because there is costovertebral joints are getting ankylosed. Very severe and very pathetic condition. So what we are telling is you should not stop pranayama even for a single day. Daily the patient has to do. Then other complications might include eye inflammation, that is uveitis. Some rheumatological disorders are affecting the ear, that is ankylosing spondylitis, reactive arthritis, psoriatic arthropathy. As these inflammatory bowel disease, IBD associated spondyloarthritis, these are affecting the eyes also. That is uveitis, choroiditis, conjunctivitis, etc. Compression fractures. Some people's bones are getting thin in the early stages of AS. Weakened vertebrae can crumble. That means vertebrae is getting weaker and weaker, and then it is liable for crumbling. And crumbling causes stooped posture. I can show you some pictures. Then what HLA-B27 means that person is at increased risk of developing autoimmune disorders. That means he is genetically he is having HLA-B27 positivity. In such persons are liable for autoimmune diseases like rheumatoid arthritis, ankylosing spondylitis, and reactive arthritis, etc. Then symptoms, lower back pain. AS is usually the disease which is missing in the early diagnosis is not possible because we are usually treating as lumbar spondylosis in aged person or IBDP in younger persons. Usually totally misdiagnosed and mistreated case. Pain and stiffness are worse at night and the morning. In the morning stiffness is there. When the patient becomes active, the pain is getting diminished. Discomfort may wake from that is while making a lateral rotation during sleep. Patient may wake due to pain. That is severe pain is experienced. Pain gets better with the activity or exercise because this is this may be a new thing to most of us. So I am telling the symptoms. Otherwise, there was no need of explaining the symptoms. Back pain may begin at SI joints. Over time, involve all part of the spine. Lower spine becomes less flexible. Over time, stand in a hunched forward position. When sternocostal joints are involved, chest expansion is affected. Swelling and pain in shoulders, knees, and ankles rarely or infrequent, not very frequent. Swelling and redness of the eye. Fatigue is also a common symptom. Patient may be affected with the fatigue and malaise. That is, without any reason, feeling the fatigue. Less common is loss of appetite, slight fever, weight loss. Then association with the psoriasis, ulcerative colitis, Crohn's disease, or eye inflammation, or iritis, choroiditis, that also common. Differential diagnosis, I think this is very important because it is very difficult for diagnosis, and missing early diagnosis, patient may be going into more and more stiffness, and the lifespan also may be sometimes getting lessened. Major confusing conditions are degenerative disc, herniated intervertebral disc, fracture and dislocation, OA, spinal stenosis, spondylolisthesis, reactive arthritis, IBD. Dish is another, because there is no time today. Dish is another that is to be mentioned along with AS, ankylosing, because both are having some similarities. Rheumatoid arthritis, psoriatic arthritis, Reiter's syndrome. These are the common mistaken diseases with AS. Diagnostic ESR, CRP. Usually the diagnosis, major thing is HLA-B27. If you are seeing, you are observing the symptoms of AS, and HLA-B27 antigen also, this can be AS. But because in the Asians and Indians, B27 is not as much predominant. Then these are some pictures. This is the modified New York criteria for the classification of AS. That I think you can know. It is a simple sacroiliitis, more than grade 2 is. Then New York criteria, that is grade 0 normal, grade 1 possibly normal, grade 2 definite marginal sclerosis. This is SI joint criteria. We are seeing in X-ray. Grade 3 is definite erosion and sclerosis. Grade 4 is complete obliteration. We cannot notice that differentiation between sacrum and ilium. That is totally ankylosed. This is SI joint degeneration. That is partially, you can say degeneration or sclerotic change of SI joint. This is a totally fused right-sided SI joint. Left side also getting fused. Bamboo spine. That is, this is already we have spoken about longitudinal ligaments, anterior and posterior longitudinal. These longitudinal ligaments are getting ossified. That is making the stiffness of the spine. This is the hunged forward position. Patient is hunged forward. That means upper half of the body is bent to the automatically. You can see the neck is also having some flexion deformity. The knee is also, the patient wants to be erect. The spine is getting, he wants to straighten the spine. That is automatically the knee is getting bent or going into the flexed condition. Squaring of the vertebral body in X-rays, we can see this is the normal with some pointed edge. This is squaring of the vertebral body. That is a later case. This can be seen even in the initial conditions. What we are saying in the patient with the beginning stage also. That is syndesmophyte. That is ossification of the. This is neck. Actually, we can see the beginning of bamboo spine in the lumbar spine and SI joint. Allopathy treatment is described here. You can refer. That is NSAID in the initial, sulfasalazine, methotrexate, corticosteroid injection, and lastly coming to the biologics, TNF alpha therapy like infliximab, rituximab, etanercept, etc. Lifestyle modifications, that is simple. Physical therapy is very important. That is very, after removing the, what I have found is after due to our treatment, usually the inflammation, amavasa, etc. is getting relieved by 2 weeks or 3 weeks. Then clubbing with, after using with the oil therapy, treatment with the physiotherapy is very, very useful for the patient. That is for relieving the stiffness, pain, etc. Feeling beneficial. Then respiratory exercises you have to advise. Rigorous exercise routine with the posture correction. But once I have met with a gross mistake with one patient. That is after Kashaya Vasti, even Neranda Mudadi Vasti, for AS patient, I have advised bed rest. That was, I think, before 10 years or 15 years. I was not knowing that after 1 week, patient has become against. We have to readmit the patient. That much stiffness happened within 1 week. That is, exercise is that much important. That is essential, inevitable thing. Spinal extension exercise. that is awareness, education is very important, because even when youngsters are getting affected, they may not be patient or they cannot accept this disease. So we have to give the counsel, minimize the prevent or these deformities are excessive dorsal, that is the deformity, natural deformity, physical therapy, aerobic exercise, walking. Then what is according to Ayurveda, what is the pathology? Asti Majjagada Vada. You have already told a crumbling of the vertebra. Majjashayam is there, Shobham is there, Stabdada is there, Hanjatam is evident, Prashtavamsha Vakrada is evident. We can see it. Asti Thadu Vurthi in soft tissue, where that usually that should not happen. That ligament should not ossify in normal subject. According to the this peculiarity of the disease, the ligament is, that is longitudinal ligament is getting ossified and getting stiffened, that is inhibiting the forward bending of the body. Then Astishaya or vertebra, crumbling can happen. So we have to go for excellent combination is Gulgulu Diktadam Hradam. Vada Kapha Dosha Prabhava. That means there is a tendency to getting inflammation every now and then. We are using Sudarsana Churna or Shadharana Churna for long time. After 2 months or 3 months, we are giving one break for one week or 2 weeks. Yes, right now treatment, that is Antarika Aushadas and Panchakarma to improve. That is Shobhagara Chilsa, that is Chilsa Tattva. Actually, we cannot see in our test. We have to see the Vadavyadhi Chilsa, already told Kavalam Dirvastamam, Ama Vada Chilsa, Samadosha Chilsa, Shobha Chilsa. This Chilsa we can club. And we have to formulate the Chilsa. Ama Vajana, Shobhagara, Jvarahara, Shulahara in the initial exercises and pranayama. Periodical IP treatment. Usually we are giving treatment every 6 months for 10 days or 15 days. Otherwise stiffness may happen. Yes, Gandharvas, usually internal medicines, Gandharvasadi Kashaya or Amrudotaram or Amruda Dudayam or Punarnavadi, Nargundi Yarandadi. This is according to the choice. Yaranda the coupled with the just mixed with the Yaranda, the Sindhu Yaranda, Gandharvasadi Yaranda, etc. Shaddarna Sudarsana Drupalayo Levajurnam. This can be given to avoid persisting inflammation or coming inflammation. Patient is vulnerable to inflammation anytime. Gulgulu Garpanas, Trayodashanga, Jandra Prabha, Desamula Haridi, Lehim, Vaishwanara Churna. Desamula Haridi can be mostly given in the morning. But Desamula Haridi, 1 tablespoon can be taken in the morning, followed by Gandharvasadi Kashaya with Trayodashanga Gulgulu or Chandra Prabha or Yoga or Vyoshadi Gulgulu. Then Panchakarma and Animanda Chilsa, Ruksha Swedam, Lebanam, Dhanyamlathara, Avigi, that is Podala Sweda with the steep, Churna Vinda Swed. Then that is phase 1. Phase 2 is Thylobasya. Then if the Ovasya is successful, you can go for Jambira Vinda Sweda. That is Jambira Vinda Sweda is very famous for to relieve stiffness, even for frozen shoulder or any lumbar spondylosis, cervical spondylosis, etc. You can use it. Thailavasti, Kashayavasti, physiotherapy, pranayama, pathyapathy. Exercise is the key factor. This is dish, that another thing that is mimicking. Yes, but the thing is that sacroiliac joint is intact. That is not affected by ankylosis. This is, etc. You can see with the dish. There is calcification of ligaments there. This is also dish, having some similarity with the syndesmophyte, that is ossification or calcification of the soft tissue. This treatment is very easy. That is what we have told about lumbar spondylosis or osteoarthritis. Exercise level, Vadastivakramam, Abhyangam, Segam, Swedam, Snehavasti, Kashayavasti, Deepana Vajana, Devi Samyukta Snehas, Kashaya Hruda Daila, Adishtra Yogas. Soriyati arthritis, I can briefly we can. This one is the last one. This disease is the last one. What is psoriatic arthritis? I think we can go through these slides. Descriptions you can refer yourself. Types of psoriatic are there. Symmetric psoriatic are there. That is happening on both limbs. Asymmetric, only on single limb. Distal, DIP, dip joint, distal interphalangeal predominant. That is another type. Spondylitis. Spondylitis is affecting the spine. This is coming under seronegative spondyloarthropathy. In the beginning, I told about 5 disorders. Psoriatic arthropathy, AS, reactive arthritis, and spondyloarthropathy coming from IBD, inflammatory bowel disorders. Then arthritis, mutilation. That means the spine is getting, the joint is getting damaged. Mutilation means damaged or erosion. This psoriatic arthritis usually affecting dip joint and pip joint. Gout is usually affecting the MCP joint. Rheumatoid arthritis is affecting PIP joint and MCP joint as well as wrist. Osteoarthritis usually dip joint and pip joint. MCP is usually spared. That is very useful slides, useful images. These are the pathologies of psoriatic arthropathy. Pitting, discoloration, swollen finger joints, sausage finger, or otherwise called ductile. That is inflammation of the fingers. Swollen heel, that is calcaneal tendinitis, is usually a feature associated with the spondyloarthropathy. X-ray of the feet, destructive form of psoriatic arthritis mutilation. Destructive form is otherwise called mutilants. You can see joints are getting eroded or damaged totally. Psoriatic spondylitis. Here also you can see bamboo spine. Syndesmophytosis. This is uveitis affecting the uvea. How arthritis affects of the dry eyes, uveitis, scleritis, cataracts, glaucoma, peripheral ulcerative colitis, these kinds of eye disorders can also be clubbed with serious rheumatological illness. Psoriatic arthropathy, Psoriatic arthropathy treatment is very complex because Tridosha Koba is there. Two diseases are, one is two very difficult diseases. Psoriasis is there as well as arthritis is there. Treat both disorders, difficult to cure. It is genetic as well as it is autoimmune. Careful on flare-up of psoriasis. If you are not suppressing psoriasis, this can occur anytime. So major, that is Swatantra Vyadhi should be suppressed in order to control this Paratantra Vyadhi. Tridosha Shamana Chikitsa, Patyaharam, Patyaviharam with exercise. Diagnosis, subtype, 5 types of subtypes are there already mentioned in the previous slide. Diagnosis is very important. Late diagnosis usually it is occurrence of joint erosion. Patient may be losing his joints. A typical presentation, arthritis was difficult to diagnose. That is very important. Usually psoriatic, 35% of psoriatic patients are subject to psoriatic arthropathy. Very rarely, that is less, around 10% patients, arthritis comes first, psoriasis second. That is very, very difficult to diagnose. Then eye disorders also be careful. Psoriatic arthropathy treatment tips. Spondylitis, that is causes stiffness on back or neck, difficulty in affects the quality of life. Mutilants is threatening, that is the erosion of cartilage is there. Keep eye on enthesitis and dactylitis because any time this can flare up. Very, very difficult to control. Never stop it. If the patient is on DMARD, that is disease modifying antirheumatic, biologics, that is etanercept, adalimumab, etc. Immunosuppressant, cyclosporin, etc. You never stop it abruptly because patient may be bedridden. Seasonal flare-ups, it is common. Appropriate treatments will relieve pain, protect the joints. That is Vada, which is going on into the Chaya in Grishma Ritu, is on Kaba in Varsha Ritu. And that Ritu Sandhi, we have to go for Virajana and treatments. Maintain mobility. Physical activity helps maintain joint movement. Yoga to relieve stress. Then treatment against some more treatment, broader health impact in Soria. Fatigue and anemia are common, mood changes are common, blood pressure, high cholesterol. These are we have to keep a watch on that. Living with the psoriasis, that is a very big topic. Living with the psoriatic arthritis, you can see in this thing in a lot of websites. Then Ayurveda, Tridosha Shamana Chikitsa, Arthropathy, Vadabhava Chikitsa, Psoriasis, Pitta Kapabhava Chikitsa, Shobhagara Chikitsa, because Shobha is a major feature. Amabhajana Chikitsa, Vedana Hara Chikitsa, persistent and recurring Amashobhas, Upashya important. Sometimes after Rushana, when we are going to Taila Prayoga, we can see sometimes the joint pain and inflammation are coming back. Taper DMARD, if the patient is getting benefit from our treatment, you can taper the DMARD. For example, methotrexate 15 mg to 12.5 mg or 10 mg, 7.5 mg, 2.5 mg multiples are safer. Vyayama is very important also to do. Then psoriatic arthropathy, OP treatment, Gulguladikta Kashayam, because Gulguladikta is unbeatable in this because it is good for psoriasis as well as arthritis. Dikta Mahadikta Kashayas, Pathya Punarnavadi for relieving the Pathya Punarnava, Sifa Kanamola Vendi, Amrudodra Kashayam to relieve inflammation and Jura. Nishotamadi and Nishotamadi for psoriasis. One usually we give Rasana Saptavam in the morning and Nishotamadi in the evening. One is for psoriasis and one is for arthritis. With Madibhadra, Kalyanakulam, Aninominatu is very, very essential. That is Madibhadra taken in the early morning. After motion, you have to take Nishotamadi or Rasana Saptam Kashaya with the proper prashava. Gulgulu Kaisharam Yogaraju. Kaisharam is more appropriate because it is having skin, it is a skin disease manifestation. Shiro Abhinga with Belaguluchadi, Eladi, Dandapara. That is accordingly. If there is Ama Shesha, there is residue Ama or Shobha, this Shiro Abhinga will be much dangerous. Abhinga with the Pindadalam, Eladi, Panjavarkadi, etc. externally. Then psoriatic arthritis tips some more. Sudarsana Churna is very good to avoid to recurrence of Shobha and Jara. Jara is not a very, but we can see there is a low grade fever is a major feature of autoimmune and these stages or the arthropathies. Low grade fever that is manifested as bitterness, kashaya asito, tremors and chills in the midnight. The patient may be feeling cold in the holes. Trifalayo labor, it is Vadashonda Jilsa, Trifala Yosha Matraila. It is with extreme pain, it is given in the noon time. Trifalayo labor mixed with in hot water just immediately before meals. And it cannot be for prolonged use because it is having Langali and Chitra. Labara with the Jadamayadi and Guluji Batradi or Nimbadi in the case of skin disease. After relieving Shobha and Ama, Vada Shodida can be, Chilsa can be preferred. Yasner Nadi, Belashada Vidyadi, Desamura Rasnadi, Prashavas Gugulu and Sebidela. Krudam is Ayaguda Mahadiktavam or Panjadiktavam. Again, some more tips with the Virajana is very good with the Nimbamruda the Erandam. It can control the joint pain also. Gulgulu Sindhuva Erandam and Gandharva in the case of spondylitis, not spondylosis, spondylitis. Shirobhingam, anemia, and anemia is also a feature with rheumatoid arthritis, psoriatic arthritis, because patient is suffering this for years and years. Then psoriatic arthropathy, some more the Dushana Langana, Snehavan, this is IP treatment. Dushana Langanam, Snehavanam, Sweda contraindicated. In the Kushta, Sweda is contraindicated. So we have to go for Kashaya Chalana. Virajana can be done. Kashaya Thara. With we can use Nimba, Hydra, Aruguda made into Kashaya. Then Potala Swadas can be done without provoking the psoriasis. Sometimes that is maybe treatment may be contradictory. Sadailan Nyavara, that is Shastika Pinda Swadam with the Thailam. Usually we are using with the Aragotha and the Bella in the 50-50. Aragotha bark and Bella Mula. Otherwise it is Bella Mula alone. That is beneficial. Kashaya was the Padola Nimba Pudiga, that is mentioned in Ashtanga Sangrha, Takrathara, Shirothara. Mrudushodanam, Amavajanam, Toyam, Palkashai. These are prophylaxis. When the disease is undergone remission, to avoid the next recurrence or flare-up, we can call Mrudushodanam periodically, Amavajanam, Toyam. Toyam is medicated, Toyam with Ayurveda, Haridra, and Shundi. Palkashayam, that is Shirapasam with the Panchadiktam, Sevidailam, protect the cartilage. Rudu Chigilsa, that is in the season. Already I told about Grishma Rudu, then Sharacharya also. Grishma Charya and Sharacharya, both seasons are very important for psoriatic arthropathy. Then IP, if possible, that can be done as prophylaxis also. Exercise, pranayama, psychosomatic, living with the psoriatic arthropathy, that is very difficult. So I think now it is the references Ashtanga Hridaya, Chikitsa Manjari, Vaidya Manorama, Sastra Yogam, then documents from Ashtavaidya tradition. Then you can refer for website NIAMS by US government, AAOS, that is Ortho Info by American Academy of Orthopedic Surgeons. These are very useful sites which can be clubbed with our Ayurveda Chikitsa, especially Vada Vyadhi Chikitsa from Ashtanga Hridaya. ACR, American College of Rheumatology, EULAR, European League Against Rheumatism, Radiopedia for studying the radiology, especially the X-rays, Wiki radiography for normal X-rays. So I think this is over. I have taken some more time. What is actually told. Thank you for tolerating and thanking the organizers, Dr. Priya. Thank you.
Thank you, sir. It was a very nice and wonderful presentation. Actually, 2 hours is not enough for lumbar spine topic, but even though sir gives a detailed explanation and it was very, very informative class. If any question is there, you can message in the chat box or you can ask directly. Sir, Abhaya Pipali Muladi Kashayam for which pharmacy?
That is why there is Abhaya Pipali. Ashtanga Hridayam, Vada Slashma Jwara Chikitsa. Vada Kapha Jwara, it is Abhaya Pipali Mula, Shamyaga Kadga Khanam. Yugvi Bandha Anila Slashma Yukta Dibara Bhajan. That is, it is Dibara Bhajanam, useful in Yug Vibandham. Srodorotham. Vibandham can be taken as this constipation also, Malabandham also, Mutra Sangha also can be taken as Yug Vibandha Anila Slashma, Vada Slashma Jwara. It is described in Ashtanga Hridayam, Jwara Chikitsa.
Okay, sir. Vaidyaratnam have this product.
Abhaya Pipali Buddha. Trifalayo Labachurno is also, it is actually, it is mentioned in Vada Shonda Chikitsa Ashtanga Hridaya, but I don't see much people using, our physicians are using Trifalayo Labachurno. It is in intractable pain. When the pain is not controllable with other yogas like Shadharana, etc. But only thing is, it is containing Langali and the Chitraga. So that is for short term. You can use with the Takra for 21 days or 1 month, seeing the patient's condition. And after a break, you can use, I take another course of Trifalayo Labachurno.
Sir, dose?
Dose is 5 to 10 grams. With hot water, it is mentioned by Acharya. We can use for a safer side, you can go for Takra. But in almost all Vada Vyadhis, this fresh Takra is not what. Then we have to heat it with some Haridra and Shundi. And making Anubana for Trifalayo Labachurno.
Hot water, Haridra and Shundi.
Haridra and Shundi. That is Takra processed with the Haridra and Shundi. You can use some other things also, Morigachi, without coconut.
Sir, any complication or side effect for patient by taking this?
Usually not, because I give only for 21 days.
Okay. 2 times. 5.
Only one day. Only it is mentioned that Acharya himself mentioned it only for Madhyana.
Oh,
that is a peculiarity for that. But we are not seeing to these things. We are not using Tripuraya language or we are not listening to Acharya. Only Madhyana is indicated with hot water, I think. Immediately close to meals. That means some defect, may gastritis or ulceration may happen if you are not unscientifically if you are using.
Along with food also we can take.
Yes. Along with that is along with the food. After having some meal or midday meal, we can use. We are using Vaishwadhara like this. Samana, that is in Samana Vaikuntya can be given between meals. Not in this any disease. That is in Udara Vyadhis, we can give it Vaishwadhara Churna or Ashta Churna in between meals. Annado Vigane Bane Samane Madhyashire, Samane Madhyam. Anna Madhyam, Samana Vaikuntya. Medications can be given at that time.
Okay, sir. Thank you, sir.
Sorry for some technical problems. I cannot do it at that time.
Okay,
anyway.
Sir. Always happen. It's okay. If any question, please message. No, I think no question. Nobody ask any questions.
I shall make some modifications with this presentation and send it to you.
Okay, sir. Hope any more questions are there, so we can wind up the class. Once again, thank you very much, sir, for your detailed explanation. Okay, sir. Good night. Thank you, sir.
Thank you, sir. Good evening. I am Dr. Muhammad Amin here to convey the gratitude on behalf of Team Ayurvisdom. Fortunately, the Sparsham online certificate course on common joint diseases was very nice experience. All the faculties, all the 8 classes covered the different aspects of joint disease from diagnosis to management. We hope it will be very helpful for our future clinical practice and career. Kindly note the program WhatsApp group will be open for coming days. If you have any queries and doubts, please post there. You will get the answers there. And I would like to express sincere gratitude to all the faculties who enriched us with precious knowledge. And we are greatly thankful to all the doctors who attended this webinar series, who made this class very successful. Please stay with us for our coming programs and ventures. Next month, December 19th and 26th, we have our next class of Naibunya webinar series on the topic therapeutic aspects of cupping. Nowadays, cupping is getting very effective and popular. So, one who are interested, please register at the earliest because the seats are only limited for first 40 participants. And one more good news for you. It is online era now. We are introducing our app named Ayurvisdom next week with a lot of specification like online consultation, clinical training classes, academic tutorials for BMS students, and some of Ayurveda courses, and a lot of commercials. And it will give you a new experience towards Ayurveda academically, clinically, and commercially. So please stay tuned with us. Thank you all. Have a nice evening.
आवाज आएगी मेरे से
क्या लगा देती है, पैसे बना देती है। अंदर ही होता पता नहीं क्या क्या लगा देता है, पैसे बना देता है। बहुत कुछ मिस्त्री में लगवाओ बता क्या करूँ। आने आया वहीं तो बना लिया उसे। मिर्ची मत लगा लगी हो जाती क्या मिर्ची मत लगी नहीं लगेगा इसको
नहीं लगेगा।
इसको तो बीज तोड़ के निकाल दो हंसी ऐसा कर डाल दो।
कैसे बना रही है, अच्छे से बनी हो। एक नींबू मंगा ले किसी से।
तो ऐसे जगह खाना चाहता है क्या
नींबू से खाना कोई दिक्कत होगा।
तो या नुकसान करेगा दही से बेकार बनेगा। मुझे भी अच्छा लगता बनता होगा।
नींबू के बिना मैं ही खाता ही नहीं हूँ।
हम खा लेंगे।
तू तो है भी मोटी, खा जाएगी। कितना टाइम लगेगा? ये मैगी मसाला भी लिया 5 वाला, एवरेस्ट भी डाल दिया, थोड़ा 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 सारा मसाला बना ले पहले एक गिलास में, सिखाया था ना तेरे को वैसी वाला। वो नहीं वो पागल लड़की है। वीडियो चल रहा है को
अभी खाना खाने क्या बना देंगे? अच्छा रुको रुको रुको। कौन सी बनी डाली इसमें? हमको ना जस्ट वो होने दो ना, रुको।